Hi, have you heard about a eating disorder? Eating disorder is a mental condition. If you observe the eating disorder, the eating habit of the person will be changed. I mean, a person who eats more than other people, or a person who eats very much less than other people. And he says that in order to reduce my weight, I am eating like this. Or you can see some people's children's or those having some mental conditions eat a non-food substance, non-nutritive substance like soil, clay, soap, paper, etc. So let me discuss one by one the eating disorder. The first eating disorder I want to discuss with you is Pica. Pica. Pica is a eating disorder where the patient will eat soap, pepper, soil, I mean clay, just like even starch they will eat. So this kind of pica is typically a disorder starting from the childhood, but you can see some women in the pregnancy period eat soil or something like this, and even this included under the disorder of pica that causes a medical risk, but it resolves after the pregnancy. Okay. So if someone asks you the definition of pica, you can say like this: non-nutritive, non-food substances at least for a month eating. Eating non-nutritive, non-food substances at least for a month is the disorder, one of the eating disorder, pica. Okay. Okay. Now we can move to the second eating disorder. Let me tell you a rare condition. It's known by the name rumination disorder. Rumination, there are some ruminating animal like cow, goat, etc. While they get grass, they eat very fast, and while they are rest, they will re-chew it. Re-chewing is known as rumination. Anyway, there are some humans who do this kind of behavior without any anatomical support. This kind of individual will cause regurgitation of the food eaten, and that they sometimes re-chew it or either swallow it or they split it off. During split it off or in other conditions, what happens is that it causes malnutrition, even weight loss. And one more thing I want to mention you that this kind of rare behavior may seen in infancy and spontaneously resolved. Thank God, because it is not a prominent disease. Thank you. Okay. The third disorder that I want to discuss with you is avoidance or restrictive food intake disorder. Again, I am repeating avoidance or restrictive food intake disorder. In this disorder, the patient have a restriction or an avoidance for food intake. He may not have an interest in food. Sometimes the taste of food may be different for him, so that he avoid the food. Or there are several emotional factors also responsible for this avoidance of food. When he avoid food, there may be weight loss, there may be malnutrition. I'm sorry, there must be weight loss, there must be malnutrition. More than that, it may cause impairment in his psychological function. And this kind of what ARFID, I mean avoidance restrictive food intake disorder, may associated with other psychiatric condition like anxiety and like more than that cognitive disorders, etc. Okay. Now let's go to the fourth one. Have you heard about some models who restrict calories food in order to get slim and preserve their beauty? And that is not a psychiatric disorder, but there is a psychiatric problem more close to this kind of behavior. In this behavior is known as anorexia nervosa. Anorexia nervosa. Anorexia nervosa is what is that? The anorexia nervosa means is there is a fear of gaining weight. The patient have very fear about gaining weight. So what he or she do is restrict the calories to reduce the body weight. And this kind of behaviors start from adolescence and this will cause very severe medical consequences and if not treated, including multi-system effect and mortality. I mean, this will cause the death of the patient if the physician not intervened properly. Okay, then let me discuss the last two eating disorders. Even while hearing the eating disorder, you may think that excessive eating. Actually, related to excessive eating, there are two eating disorders. The first eating disorder I want to tell you is binge eating disorder. Binge eating disorder. Binge means excessive. Binge eating disorder is the disorder of excessive eating, and the patient lost control over eating. And unlike other conditions, this kind of excessive eating has a better prognosis by medical treatment. Now, another eating disorder related to this excessive eating is bulimia nervosa, which you may not observe. Bulimia nervosa is an eating disorder in which there is binge eating, there is excessive eating, followed by compensatory exercise, I mean excessive exercise. Excessive eating and excessive exercise. This is a psychiatric condition and you have to give more attention just like that anorexia nervosa. The individual loss of control over this food and he do excessive exercise as a compensatory mechanism for him. You may think it is normal, but it is an abnormal, it is an eating disorder, it's a psychiatric issue. Okay, and it starts in adolescence.